Hi, everyone. Thank you for taking the time to join Idaho's Healthcare Landscape Policy Changes and Impacts webinar. I am here today to give you a whole overview about Idaho's healthcare landscape and all the things that are happening right now. So today I'm going to talk about Idaho's Medicaid program because it plays a pretty significant role in our healthcare system, as well as a lot of policy changes that have happened in the past year. I'm going to also cover recent policy changes that are going into effect that have passed also in the last year, how that has an impact on Idaho, Idahoans, our healthcare infrastructure, and then talk about what you can expect for the current legislative session and this upcoming year. And then I'll finish on how you can have an impact on the policies that have been proposed, as well as those that we are anticipating to be proposed this coming year. My name is Hillary Matlock. I am the policy director at Idaho Voices for Children. We are a nonprofit in the state focused on championing policies that impact kids and families in the state. And my whole area of expertise and background is in healthcare policy. I've been working in healthcare policy largely in the Medicaid space for almost a decade now. And so I am excited to be here today to share all these updates. Now, I am going to introduce Idaho Supports Medicaid. We are a statewide network of healthcare advocates and providers and stakeholders that are working to keep Medicaid strong, for Idahoans to get the care they need, for children to grow and develop, parents to participate in the workforce and provide for their families, and also to promote healthy communities. Idaho Voices for Children coordinates Idaho Supports Medicaid, the statewide network, and the partners that we have a part of Idaho Supports Medicaid are listed here on the screen. We have St. Alphonsus, St. Luke's, Hospital Association, Idaho Oral Health Alliance, the Medical Association, AARP, Idaho Academy of Family Physicians, to name a few of our partners that work very diligently with us in this space. So to kick it all off, I want to first of all talk about Medicaid. Now, Medicaid is such an integral part of our healthcare system. And what is needed to really understand all of the policy changes and the implications, we really need to have an understanding of what the Medicaid program is. Who does it serve? What does it cover? What does it take to qualify? So we're going to start out with that. Now, to start out, we're going to talk about a lot of numbers. We're going to talk about costs and budgets and trends and legislative proposals and policies, but really what it comes down to is Medicaid makes a difference for families. It covers children. Half of the population are kids. It also helps people with disabilities live in the communities. It helps seniors who have limited resources. And then it helps low-income working adults have access to health insurance so they can be healthy and take care of their families and participate in the workforce. And here's a handful of Idahoans who are on the Medicaid program today. So let's talk a little bit about what Medicaid covers. Medicaid is health insurance. It provides health insurance assistance to people who qualify for the program. And there are different programs based on different populations, but primarily these are benefits, some of the benefits that Medicaid provides. It includes preventative screenings, hospital services, home and community-based services, which are for people with disabilities, cancer treatment, and mental health services and behavioral health services. In fact, Medicaid is one of the largest behavioral health payers in the state of Idaho. And 1 in 3 Idahoans on Medicaid expansion have a serious mental illness diagnosis. Since Medicaid expansion became available, it filled a pretty significant need in our behavioral healthcare system. And it is a major coverage source for behavioral health services like substance use and psychiatric treatment. So let's talk a little bit about who does it cover. Now, to qualify for Medicaid, you do have to be a U.S. citizen and an Idaho resident. Undocumented individuals don't actually qualify. You also have to meet income requirements or have a disability. Medicaid also covers children and pregnant women in low income families and some seniors. Now, in 2018, Idaho passed Medicaid expansion through a very popular ballot initiative with 61% of the vote, after the legislature failed to pass a legislative solution to close the health coverage gap. Now, before Medicaid expansion, to qualify for Medicaid, you had to be a parent and make only a few $1,000s a year. So that's where you see the 0 to 25% of the federal poverty line. That was what it took to qualify before we had Medicaid expansion. After Medicaid expansion passed, Idaho adults could qualify if they made under about $44,000 a year for a family of four, or $21,000 a year for an individual. And so that is when you look at the 0 to 138% of the federal poverty line, that is what Medicaid expansion covers. For those making over the income threshold for Medicaid expansion, families and individuals making up to 400% of the federal poverty line, so that's about 130,000 for a family of four, could qualify for a tax credit to purchase health insurance on the state health insurance exchange. So prior to Medicaid expansion, you see this umbrella here where it says Medicaid expansion. We had a pretty big gap between traditional Medicaid and marketplace state health insurance exchange tax credits to purchase that health insurance. And so Medicaid expansion really filled that gap or closed that coverage gap when it became enacted. Prior to expansion, if you fell into this income range or you didn't have any children, you pretty much went without because there were no affordable health insurance options for you. Now, another thing I always like to mention too is Idaho is pretty strict on its income limits. We cover children last in the nation compared to every other state. So for a family of for children, you can't make more than 190% of the federal poverty line, while most states cover about 250% of the federal poverty line. And we also are ranked last in the nation for income requirements for pregnant women as well. You can't make more than 138% of the federal poverty line, which is also the Medicaid expansion threshold. Most states cover pregnant women at that 200% of the federal poverty line or above. I do want to talk for a minute also about Medicaid expansion. Prior to Medicaid expansion, we had a patchwork system of coverage for very few individuals. And the state was putting state and local taxpayer dollars into behavioral health services, into medical care in the correction system, substance use programs through the court systems. And then we also had county indigent and state catastrophic care funds for people who were uninsured. If they had medical emergencies, they would help pick up some of the costs. So after Medicaid expansion was implemented, we found about 90,000, we currently now cover 90,000 Idahoans that otherwise would have not had any health insurance options. So now Medicaid expansion covers approximately 90,000 people. There was also an economic study done in the past year that shows Medicaid expansion actually creates a lot of economic benefits. For every dollar of federal funding invested in the state for Medicaid expansion sees $1.82 in economic activity. And so that results in about $157 billion coming to our state economy every year. This also trickles down and produces about 12 million in property tax revenue and 35 million in general fund revenue. And then when you have this much money coming into our economy, it actually helps produce extra jobs in the healthcare industry because more people have insurance, more people are needing services and able to go to the doctor. It has helped create jobs. So it adds about 9,300 jobs annually for just by having Medicaid expansion available. Also, Medicaid expansion helps support rural hospitals and providers where access to care is fewer and far between compared to our urban centers. And so having fewer people that are uninsured actually helps keep our rural hospitals and clinics viable and keeps doors open. And it also helps keep uncompensated care down. When you have fewer people going to the emergency room who are uninsured, it reduces uncompensated care. And I'll talk a little bit more about that in a minute. So I'm going to talk a little bit about Medicaid costs because Medicaid costs and Medicaid budgets are talked about a lot within our state lawmakers. And it's been a pretty big focus over the past several years. And it's really important to understand where does the money actually go when you're looking at Medicaid costs. So for Medicaid expansion, for example, for every $1 the state puts in and out of our general fund dollars, the federal government puts in $9. So that equates to about $1 billion in federal funds coming in to help pay for Medicaid expansion annually. For Medicaid traditional populations, so those are your people with disabilities, children, seniors, pregnant women, the match rate is closer to about 67% of the federal contribution. So the state contributes the rest. One of the things that it's really helpful to know, and I could spend hours talking about budgets, but for today, I think what is really helpful to know is when you look at where all the dollars in Medicaid go, I think it's really important to note that administrative costs in the Medicaid budget are very low. So you're looking at about a 5%, 4.5% in administrative overhead to pay staff at the department and to pay processing claims. The rest, where it says trustee and benefit payments, that is healthcare services. So the majority of the budget, about 95% of the budget, goes directly to healthcare providers to pay for services rendered. Now, when you compare this to private insurance and how what their overhead is, it's anywhere from like 15 to 20%. So Medicaid is a pretty lean program. Now, when you look at where are the cost drivers in Medicaid, you really have to look at where the top three spending categories really are going to be your disability services, pharmacy, and inpatient hospital. These are the highest cost services. Oh, goodness. Sorry about that. My mouse got away from me. So I want to talk for a minute about this chart. When you first look at it, it might be a little bit confusing, but Medicaid enrollees versus expenditures. So different populations have different costs based on different healthcare needs. So for example, when you look over here where it says children, these are children who are pretty healthy, don't have disabilities. They make up about 43% of the enrollees in Medicaid. However, they're only about 17% of the expenditures for the Medicaid, for the dollars coming out of Medicaid for our general fund. Now, the general fund, I'll just mention really quickly, the general fund is where all of our state taxpayer dollars go that they use to contribute to the state portion, like education and health and welfare and other agency budgets. And so when I say general fund, I'm talking specifically about state taxpayer dollars. When you look at children with disabilities, it's a much smaller percentage of the enrollees, but their expenditures are quite a bit higher than children without disabilities. Expansion is pretty low it's about 28% of the population. However, it's only 8% of our general fund expenditures. And a lot of this is because our federal match is quite a bit higher than the traditional populations. For seniors and people with disabilities, this is the population with the highest need. People with disabilities are quite much more expensive to cover. They have a lot more needs. And so when you look at how much of the budget goes to pay for people with disabilities, it's closer to that 57%. For seniors, seniors, people with disabilities, they're about 14% of enrollees. And now the other bar, pregnant and basic adult. So those are going to be very low income parents who are still below that 25% federal poverty line threshold, and pregnant women. So the thing is, health insurance costs are going up everywhere. And we're always talking with lawmakers and hearing in the news about how Medicaid has seen incredible growth over the past several years. However, you need to really zoom out and look at it in context of what is happening around everything. Look at all industries across the board. Healthcare costs are rising everywhere, not just in the Medicaid program. However, the Idaho Center for Fiscal Policy did an analysis that showed inflation and total general fund expenditures actually grew faster between 2019 and 2024 than actual growth in the Medicaid program. So when you average year over year growth in our general fund expenditures versus our Medicaid general fund expenditures, it actually came in lower than both our total general fund expenditures and also lower than inflation. So when you really look at everything when you're talking about Medicaid, all of these pieces need to be taken into consideration. Who is being served by these programs? Where are the costs coming from? Where are we seeing significant growth? And where are those cost drivers happening? To really understand the complex nature that is Medicaid and the growth, but also who it serves. And it's important to understand all of these things because it helps to inform and understand why and where some of these policy changes are going to have an impact. And so now that you are an expert in the Medicaid program, I am going to cover recent policy changes. So when looking at to this past year, there are several policy changes that are having an impact on our healthcare system. And these major policy changes are taking effect essentially from 2025 through 2029. And you can really pinpoint to three major policy decisions. House Bill 345, which passed the state legislature last legislative session. HR 1, also known as the One Big Beautiful Bill Act. Lawmakers are calling it OB3, and I'll be referring to it as OB3 through the remainder of this presentation. And then last fall, the Idaho state governor had requested some budget holdbacks. So we were seeing that we were having revenues come in lower than projected, that we were going to be in a potential deficit in the coming year. And so the governor responded by doing budget holdbacks in state agencies. And this did have an impact on some cuts to the Medicaid program that I will also cover. So let's talk about these healthcare cuts and changes. So these are largely taking effect from 2026 through 2029. I'm going to start with the ones that happened first. So as part of the governor budget holdbacks, the Department of Health and Welfare cut provider payments by about 4%. This did result in some services actually being cut altogether. We saw occupational therapy and speech therapy visits be decreased down to a cap of 20 a year. We saw some services actually have be cut in the behavioral health space. There are some services that were exempt, but those went into effect between September and December of 2025. The next thing that was a change as a result of the policies passed last year is some pretty significant changes to the Medicaid expansion program. And one that starts this year is more frequent eligibility checks. Medicaid expansion is going to be having to renew every 6 months instead of annually. Healthy Connections is a program that was ended by House Bill 345 effective January 1st of this year. It essentially was a care coordination program that helped patients stay out of the emergency room and help coordinate their care. So this program was cut starting January of this year. Work reporting requirements, also known as, may have been heard of community engagement requirements. These are starting at the pretty much at the very end of this year, where if you're enrolled in Medicaid expansion, you have to meet certain requirements to be able to keep your coverage. And there's different exemptions. There's going to be different work requirements, volunteering, education requirements, and documentation will have to be submitted to ensure that you are still eligible for the program. They also shortened retroactive coverage from 90 days to 60 days for all populations, but the expansion population, which has been reduced to 30 days. So if you were eligible prior to eligibility for that time frame, you can get back coverage to help pay with any medical bills. So they've shortened that time frame. And then also cost sharing, or also known as copays, are now required starting in October of 2028 is the latest that I have heard that they plan to implement changes for cost sharing and copays. This could update as time goes on, and as we find out, we'll communicate that out more. But essentially, they implemented cost sharing and copays across all Medicaid populations at the maximum federally allowed limit. And so we are going to see that requirement more for Medicaid enrollees. And then also there is the move to managed care. So right now, Idaho Medicaid has a few very small small managed care plans in behavioral health and dental, and in our duals program, which is your Medicaid and Medicare eligible folks. And what this will do is it requires all of Medicaid to have the entire population enrolled into a managed care program. Now, managed care essentially means that instead of the department managing the care of the staff at the department managing the care and coordination for people in the program, it is going to be handed over to basically health insurance companies to manage the care and coordination of the populations on Medicaid. There were some changes this last year that to our state health insurance exchange and the amount that people are able to receive in the form of tax credits. So a couple of years ago, Congress had passed a short-term measure to enhance the tax credits that people get to help during the time of economic upheaval and challenges that people were having. So the tax credit that people are able to qualify for to access a health insurance plan was some assistance. That amount was increased. However, it expired December 31st of this last year. Now, while the tax credit is still available, a lot of people are losing those enhancements, and it's having a pretty significant impact. So to give you a sense of what that looks like for a family of four, say they're 205% of the federal poverty line, that's about $66,000 a year. They're seeing their out-of-pocket expense for premiums almost triple. And then if you're looking at if at the very bottom, you can see here where it shows 402% of the federal poverty line for, say, a 60-year-old couple, their premiums are also tripling. And a lot of that also is because there was an additional measure that was passed to remove the cliff that was previously there. So you could only qualify for a tax credit up to that 400% of the federal poverty line. With the enhancements, they also removed the cliff and tapered it according to your income. So you never paid more than 8.5% of your income towards your premiums. Well, that measure also expired. And now if you are making over 400%, you are now falling off that cliff and you don't receive any tax credit to help you with your health insurance. Another measure that was passed as a part of OB3 is the Rural Health Transformation Program. And this is going to be in a lot of discussions this coming year, especially this legislative session and amongst hospitals and providers, especially in rural areas, because it's a pretty significant amount of money that's being invested into our rural health system. It's almost about $1 billion over the course of 5 years. And what this is, it is going to have the legislature is going to have to approve the funding for this program. However, it is time limited. It's only available for 5 years, and there's a lot of limitations to this program. It is going to include a lot of tech upgrades. There's some provider incentives to recruit and retain new providers in rural areas. It expands some telehealth, and there's some good elements of it that I think will be really beneficial to our rural healthcare communities. However, it does have limitations in that it is short-term funding. It doesn't replace health insurance for any Idahoans who are going to be uninsured from any of these cuts. And it doesn't replace funds to providers from the Medicaid cuts that have already been instituted from the governor holdbacks. And another thing that is interesting. It has some very strict guidelines and how the funds can be used. And then also we may see the legislature also form an oversight committee that may further limit the use of those funds. So now I want to talk about what all of these policy changes mean for Idaho and Idahoans. So I talked about all of the different changes to the Medicaid program, our state health insurance exchange, this rural health transformation program. We're seeing a lot of pretty significant shifts and changes happening in these different areas that is going to have a pretty significant impact to our whole healthcare infrastructure, to Idahoans, and also to our healthcare landscape as a whole. So I want to talk for a minute about what is the impact when you see federal cuts to Medicaid? How does that impact our state economy? When states receive a reduction in federal funds, it ultimately reduces the amount of state spending, which has a pretty widespread impact. So I know I mentioned earlier that for every dollar in federal spending, it results in for every reduction in a dollar, we're going to see a reduction in $1.82 in the state economy. So, so that's going to have an impact. So you're going to see those cuts to federal Medicaid funds. You're going to see a reduction in state Medicaid spending. And so how you see this trickle down is it has a direct effect on healthcare providers because they're going to see a reduction in payments. And then if they're getting a reduction in payments, it has an indirect effect on, okay, so how is this impacting my ability to pay my employees, to pay vendors, buy supplies? And then if you're reducing all of those different areas, it's going to have an effect in local economies. So the ability for employees to go out and purchase food or shoes for their kids or school supplies, it reduces the amount of money circulating in local economies, which then trickles down and reduces state and local tax revenue. So while these reductions are going to have an impact on healthcare costs and have an effect on our economies, it also has a direct effect on what we're going to see in our uninsured rates, which also has an impact on everybody, not just those who have maybe potentially lost the program. So when you're cutting funding for public health insurance programs, you're going to see a rise in the uninsured rate. Fewer people can afford or access health insurance, so it increases that uninsured rate. That then leads to uncompensated care. So hospitals and providers are basically providing services without receiving any payment. Well, those costs just don't disappear. They end up shifting, and providers have to make up the cost somewhere. So they raise prices to offset those losses. And how those actually shift, they raise their prices. Then we see higher health insurance premiums on private insurance. So insurance companies increase those premiums to cover those rising costs, which then the higher healthcare costs, the higher health insurance premiums, we end up just seeing fewer and fewer people choose to stay insured because they just start getting priced out. And then you just create this cycle all over again. So one of the things that some of our analysis is with all of the changes happening from these policies, we are expecting a pretty significant increase in the number of uninsured Idahoans over the next couple of years. So particularly in the Medicaid program, we're seeing a going to likely see about 40,000 people lose their health insurance coverage and Medicaid due to the policy changes. And then approximately 35,000 Idahoans would be newly uninsured from the state health insurance exchange changes. So when you have that number of increase of uninsured Idahoans, that has a pretty significant impact to healthcare. When more people go uninsured, we have not only higher uncompensated care, we are going to see fewer providers able to actually accept Medicaid patients. We're going to see providers potentially leave the state or close their doors altogether, particularly in rural areas. So when you have a provider who has a mixture of Medicaid, Medicare, private insurance, a lot of times they have to offset low reimbursement rates by increasing costs and increasing rates in other areas. And so when they start losing Medicaid patients and they're getting less and less reimbursement for Medicaid patients, puts them in a tight spot to where they have to make hard decisions to potentially have wait lists or stop accepting Medicaid patients. The problem is rural providers get impacted the most because there's a higher share of people on Medicaid in rural areas compared to urban areas. Just to give you an example, there's about 36% of kids in rural areas are on Medicaid compared to about 33% of kids in our more urban areas. So when you have fewer providers able to accept Medicaid patients, you're going to see longer wait times for care. So you're also going to see higher emergency room utilization because people are not going to go and get their checkups. They're not going to get their preventative care. They're going to put off going to the doctor unless it's starting to get really bad, which means they're going to wait until it's more emergent, and then they're going to have nowhere to go but the emergency room, because the emergency room is basically the safety net anymore for Idahoans who are uninsured, which then goes to uncompensated care going up and that higher health insurance premiums for everybody else. One of the things that happened after Medicaid expansion passed is our safety net programs, the state and catastrophic care funds and county indigent funds were repealed. So that was the safety net prior to expansion. They've removed those safety nets. And so when you have more people going without health care, the only safety net available anymore is the emergency room. So let's talk about how this impacts hospitals. So we have 27 rural hospitals in the state that are really feeling the effects of all of these different cuts. We're seeing state cuts, you have OB3 cuts, the workforce on top of workforce shortages, increasing healthcare costs and inflation, and then you have decreasing payments to providers, plus the move to managed care really is creating this perfect storm of instability within our hospital systems and within our healthcare delivery system. We're seeing about half of the rural hospitals are operating on less than a 1% operating margin, and 8 are at risk of closure. Now, when you look at this and you think of how big Idaho is and how vast the space in between all of these rural hospitals are, you really have to ask yourself, if my local rural hospital were to close, how far am I going to have to drive to get to the nearest hospital or the nearest emergency room? So these cuts really are going to impact every Idahoan's access to care. We're also seeing a lot of pressure on providers. We know that we're experiencing a provider shortage in the state. 36 out of 44 counties have a mental health professional shortage. 1 in 3 counties are considered a maternity care desert. Almost every county but one is designated as a healthcare professional shortage area. We're last in the nation in pediatricians per capita. We also have lost about 35% of our OBGYNs. And so we are seeing increasing pressure put on our existing providers in the state by all of these healthcare cuts that have come down from OB3, as well as the budget holdbacks and all of the changes from House Bill 345 that um, we'll see this play out more and more over the next couple of years as these policies become implemented. Now, all these impacts really do go beyond healthcare. It has an effect not only on our local economy, we are going to see decreasing workforce. When we have less money able to go out into our healthcare industry because of provider payment cuts, we're seeing jobs get cut. We're going to see a decrease in that tax revenue. And it doesn't address Idaho's need to grow its healthcare infrastructure. We have seen incredible growth in population in Idaho, and we're always talking about the need to grow our infrastructure, to have education and schools for our kids and roads to drive on and access to public lands and all these different infrastructure needs. And really, Idaho's healthcare infrastructure is a part of that. Its needs are growing as well, and these cuts are not helping. Law enforcement and first responders are called more often to handle mental health care crisis. So when individuals lose access to their services that help them with their mental health, case managers, access to prescriptions to help them manage their mental illness, when those go away, the first responders and our law enforcement are the ones who get the brunt end of that. They are called more often to handle those mental health crises. We also see counties face higher costs to keep county hospitals viable. And some of those rural hospitals I had mentioned, some are considered county hospitals, where if they have budget problems, it's up to the counties to help keep those hospitals running. And so if they are having high uncompensated care, then it's going to impact county budgets and property taxes and all of those things in people's local communities. And then, not to mention how this impacts people. When you see 40,000 people potentially losing their health insurance over the next couple of years, on top of 35,000 Idahoans from losing tax credits, families are feeling the brunt end of this, and they're going to delay care until problems become emergencies, which means individuals are sicker, and it threatens their ability to work and participate in the community. Okay, I'm going to talk about 2026 legislative session, some of the things that we are seeing proposed currently and what we anticipate in the coming year. So one of the things I had mentioned earlier, that healthcare costs have been going up everywhere. And you can see this in health insurance across the board. Premium rates are going up about 10% on average over in this year for health insurance. This is for individual and group insurance. Also, with the end of the enhanced premium tax credits, state officials are anticipating about 20,000 out of that 35,000. We're likely to see about 20,000 people probably going to drop their coverage this year because of affordability. After we got through open enrollment, we saw about 9,000 people originally disenroll in coverage. New enrollments were down 22%, and about 60,000 people out of that, about 144,000 people enrolled in health insurance exchange plan. About 60,000 dropped down their tier due to affordability. So they went from like a gold or a silver down to like a silver or a bronze plan to be able to afford their premiums. A thing that's really been driving a lot of the topic of conversation this legislative session is we're having a reduction in revenue, which is creating budget strains. And for the last several years, Idaho had pretty significant surpluses due to an influx of federal funding during the COVID era to help cover a lot of challenges. Well, a lot of those surpluses have now gone away, on top of the fact that Idaho's legislature has passed some pretty big income tax cuts over the past 5 years. This has made a pretty big impact on our revenue. We're seeing about a $4 billion decrease in revenue from the income tax cuts, and we're anticipating another $4.5 billion to be lost in revenue because of those same ones over the next 4 years. So a lot of the revenue reductions is really driven by these policy changes. And while everybody definitely can agree, affordability is a problem. Everybody loves to pay less in taxes. It does come with some consequences in how the state is able to use that revenue to pay the bills. See, in Idaho, we have a balanced budget. We have to have a balanced budget. So we can't spend more than we bring in. So if we're losing all this revenue due to these tax cuts, then we can't spend more than we're actually bringing in. Another big decision that the legislature is going to have to make this year is which tax provisions we adopt, which could also further decrease revenue. So OB3 or HR1 that passed last year had a lot of tax changes as well. And the state legislature has to conform to those tax changes if they want to. So there's a lot of conversation around individual and corporate income taxes and which ones to actually conform to. And this could actually further decrease revenue for our current year and the coming year that we're working to budget for. So like I had mentioned, the legislature has to pass a balanced budget. It's a constitutional requirement. And so they have some pretty hard decisions this year. Every other year over the last 5 years, we've been in a surplus. And now we have less money than we anticipated to pay our bills. And so this is what prompted the governor budget holdbacks. And legislators are saying, hey, like we need to look at opportunities to make cuts. So on January 12th, the governor kicked off the legislative session with a State of the State address where he unveiled his plan for his budget and his proposal. Then it is up to the state legislature to look at his proposal, what the state agencies are requesting, and then what the legislature wants to officially pass as a budget. The top things in healthcare from the governor's proposed budget that I'll highlight here is he does not recommend a repeal of Medicaid expansion. He actually explicitly came out and said he doesn't recommend that. He does recommend investing $1 million in medical education programs, and then recommended about $45 million more in state cuts to the Medicaid program. And where those cuts he is proposing come from is making those 4% provider payment cuts permanent, which is about $23 million annually. And then he also provided from the Department of Health and Welfare a menu of service cut options and essentially said, find another 22 million in this list. And I will leave it up to you to decide which ones on this list you would like to cut. And so some of the lists that I'm going to highlight here is home and community-based services, which serves people with disabilities, pharmacy benefits for some adults, some provider rate cuts to hospitals, therapy services, case management, hospice, and home nursing services. One of the things I will mention, all of the service cuts that are in this menu of items is very geared towards seniors, people with disabilities, and low-income adults. Children are largely protected from the service cuts. Where children are being impacted the most is from this 4% cut to provider payments. It is impacting providers that children do see. Additionally, while the governor is not recommending repeal of Medicaid expansion, the legislature is talking about it. So some legislators are still talking about repealing Medicaid expansion to help with the budget problems that they are experiencing. So about this last week, the Idaho Health and Welfare Committee, so these are in the state legislature. There are committees assigned to work on policies related to the Medicaid budget. That's going to be your House Health and Welfare Committee, as well as the State Senate Health and Welfare Committee. So the Joint Finance Appropriations Committee co-chair, came to the policy committee and said, we set the budget, but you set the policy on what services we can cut. So it's really twofold. You're going to have the finance committee has to set the budget, but it's really up to the health and welfare committees to set the policy and decide, okay, well, which services do we need to pass a bill, pass some legislation to remove from the Medicaid program? And then breaking news as of today, Idaho state agencies were told to submit a plan for even more budget cuts. So this is brand new information. We're still trying to understand what this would mean for the Medicaid program in particular. But the legislature finance committee, the Joint Finance Appropriation Committee co-chairs, so this is co-chair Senator Grow and co-chair Representative Tanner, they submitted a letter to state agencies saying, okay, the governor had requested a 3%. We want to see what a 5% cut would look like. So we anticipate what those further proposed cuts might actually look like after they're submitted. Hopefully, with they were given until this Friday to submit these plans. So the end of January is when they're being asked to submit updated options for additional cuts to programs. So I want to talk briefly about Medicaid expansion risk, the repeal, the chance of it actually getting repealed. There's a lot of back and forth right now in the legislature on whether or not Medicaid expansion should be repealed. This is going to be a likely ongoing debate. We're likely to see legislation to repeal the program come forward, where there will be opportunity for public hearing and comments. And so stay tuned. I'm sure you will be informed if this is an opportunity comes up. One of the things that is, I think, really important for people to understand is what is at risk if Medicaid expansion is repealed. Well, from a high level, it's going to cost the state more money to repeal expansion. A lot of this is because all of those other programs that I talked about earlier, behavioral health, county indigent and state catastrophic care funds, courts and corrections, those programs will see budget holes, and the state will still have to pay for those programs if expansion goes away. We're also going to see some areas of the budget for our state hospital south and state hospital north that are covered with expansion, as well as some hospital taxes that are leveraged to cover funds in the Medicaid program as well. So there's a lot of pieces at play. In addition to the fact we would lose about $1 billion in federal funding coming into the state that go directly into our healthcare system, that would have a devastating impact on our infrastructure, our providers, our rural hospitals. And it not only is going to cost the state more money to repeal expansion, it'll increase our deficit because we have property tax revenue and general fund revenue and jobs that are created from expansion that will go away. And so we will see an increase in the deficit if expansion were to go away. And then also speaking to what we had talked about earlier, when 90,000 people lose health insurance, you're going to see more uncompensated care, higher insurance premiums, longer wait times at the hospital, and potential hospital closures and clinic closures. And we won't be able to meet our population growth demand. And so what does this mean going forward? We put together some policy options for lawmakers to consider this legislative session. We are asking that House Bill 345 and OB3, let's let this be implemented and assess those impacts before further cutting Medicaid. Like I had mentioned, these are House Bill 345, OB3, those are the biggest reforms in history to the Medicaid program and the biggest cut to Medicaid in program history. We really need to let all of these massive changes settle and assess them before we further cut the Medicaid program. We're also asking them to preserve Medicaid expansion as well, in addition to reinstating Healthy Connections, reversing Medicaid provider rate cuts. Reinstatement of Healthy Connections we see as a way to help reduce emergency room visits, help care coordination. It's a money saver. We are also asking to reverse the Medicaid provider cuts, or at least not make them permanent going into the upcoming year because of the access to care problem it's going to create for Idahoans who are on the Medicaid program. So here are some takeaways. When we're having a conversation with lawmakers and in our communities, these are the things that we talk about. Healthcare can be part of the solution, not necessarily the problem. For economic growth, we need healthcare infrastructure growth. Cuts to Medicaid affect everyone, and higher insurance rates increase uncompensated care in strained hospitals. Cuts to healthcare put your local hospital and clinic at risk of closing. Also, most Idahoans don't actually really want a tax cut. They want to be able to go to the doctor. If tax cuts are meaning that they have to make cuts to healthcare, many are actually finding they would rather be able to go to the doctor when they need instead of saving $50 that year. Further reductions in revenue are going to further strain healthcare resources and just reduce access for everyone. So now I want to talk about how you can have an impact. It can be very overwhelming and to understand, okay, I am understanding how this is impacting my community, my patients, my family, my friends. I have a story to share. I want to share how this is why it's so important that we protect Medicaid, protect access to healthcare. So how you can do that is you can contact your legislator. They are very accessible. We have 105 legislators that are there to represent their constituents. They want to hear from you. So you go to the legislature websites, legislature.idaho.gov, and up in the right-hand corner, you just click Who's My Legislator? Enter in your address, and your legislator will pop up, including their contact information. You can email them, you can call them at the down at the Capitol. They are there to respond to their constituents, and they want to hear from you. They want to understand. A lot of legislators are ranchers and business owners and in their communities, and they don't understand the complex system that is healthcare and what providers and communities go through. And so really with how much legislation comes through the legislature and how much they have to evaluate, they really rely on hearing from their constituents to help inform their decisions about these policies. So I highly recommend going, find who your legislator is, look at their email and send them an email, reach out to them, make a phone call. And if you need further help, that is what Idaho Supports Medicaid is here for. We have a website. It's called idahosupportsmedicaid.com. You can share your story with us. We are here to listen. We collect stories of impacted providers and people who are on the program, that are on the Medicaid program, who are going without health insurance, having healthcare access issues. We want to talk to people. So we collect stories. We also have an action opportunity. So every time a bill comes up or there is a particular proposal, we want the community and constituents to weigh in with their legislator. You can click our Take Action page and send an email through our action tool. We also have a bunch of resources, talking points. We have a whole advocacy guide on how to navigate the legislature, how to navigate giving testimony, how to sign up for testimony. You can access that under our resources page. We have fact sheets on Medicaid expansion, all of the policy proposals I talked about today, as well as legislative district fact sheets. And so we really want to be here to be a resource for you to make advocating for healthcare in Idaho as easy as possible. And last but not least, you can subscribe to our newsletters. We send out regular newsletters, especially during the legislative session. We have monthly webinars. We send out regular updates to keep you in the know of what's happening at the Capitol and happening in different policy proposals. So we are here as a resource. Please utilize us. And just want to thank you for taking the time to walk through this presentation today. And if you ever have any questions or need any assistance, please don't hesitate to reach out to us on our website. There's a form on the website that you can contact us, and those emails go directly to me. So if you have questions, you can go ahead and submit that, and we're in this together. And thank you all so much for taking the time today.